This is Bob Brown with Community Coronavirus Update number 98. Today we'll talk about the COVID hospitalization rates, which are the highest this year, and some ideas about mandating responsibility versus vaccines to get to 85%, which is what we're going to need to if we want to be past this pandemic. So unfortunately, if you follow the headlines, Nebraska's COVID cases and hospitalizations are the highest they've been since January. And as Dr. Matt Donahue, our state epidemiologist, says, COVID is still with us, but vaccines are the way out. And how are we going to get there? Well, how bad? Well, we're up to 513 hospitalizations as of yesterday in the state, which is the highest it's been since December, January. So we could actually be heading back to December and November levels like last year. The biggest jump is coming out of Omaha with over 50 more hospitalizations heading up there, which just is pushing Omaha hospitals to the highest capacity they've been in this pandemic. We'll see. Hopefully this doesn't get too much worse, but this is going to be a serious problem. We could be getting to crisis standards of care in Omaha if this continues to worsen. In Lincoln, numbers are actually a little more stable. If the blue line here is people from Lincoln, actually the orange are people from outside of Lincoln, because Lincoln cares for, it's a regional medical center. But numbers here really aren't that bad, I guess, as compared to the other rest of the state. Brian actually breaks down again the unvaccinated versus vaccinated, but I think we need to clarify that of these 15 vaccinated, most of them are people who should have gotten their booster but didn't. So we really need a third category: initial vaccinated and booster. I talked to a critical care doctor earlier this week, and he said the only patient he's seen in the hospital with a booster was a patient who was on chemotherapy. And so most of these people who are quote vaccinated are people who should have gotten a booster. And so if we could fix this, we'd drive the hospitalization rates even lower. Another way to look at it is this sign, that the vaccination rate for the vaccinated versus, or the hospitalization rate for the vaccinated versus fully vaccinated. These fully vaccinated are not, quote, fully vaccinated anymore. What you're seeing is this waning immunity. And if there was a booster dose given here, we probably would be preventing this little uptake. It's not a very big uptake, but it's still there, but we could reduce that even further. Unvaccinated, we just got to figure out how do we get those unvaccinated people vaccinated. The studies coming out on the booster effectiveness, once people get a booster within 2 weeks, the infection rates drop about, you go all the way to about 94% protection for Pfizer. So getting the booster makes a huge difference. And so I think, like a lot of experts, this really probably originally should have been considered a 3-shot series. We just didn't have the time. Now that we've had enough elapsed time, we figured that yes, you need a booster just like so many other vaccines after a while. So Nebraska's rates unfortunately are headed up, and I think that these are actually quite an underestimate, and the big reason being, of course, this positivity rate. If you look at it broken down by region, what you'll see is Lincoln Lancaster County numbers are probably fairly accurate because our positivity rate. This means that we're actually probably testing enough people, whereas every place else, this should be probably in the 5% or lower. This means that the rates in these other areas are probably anywhere from 2 to 3 times higher than what this number suggests. So you can't really compare Lancaster and say Douglas is no worse than Lancaster because of this positivity rate here. That's why in the New York Times, when they have their risk level, they use a combination of cases and test positivity. So most of Nebraska is in the high risk zone at this point. Sometimes these small counties will flop around just because there's such low population size. The numbers are kind of erratic. Essentially, basically all of Nebraska is high risk right now. I think it's worth taking a look again. As I keep saying, the ultimate judge of your public health effort is the proportion of dead and not dead. And so now that we've got pretty solid data across the country, we can see who has done it the worst in the country and who's done it the best in the country. Mississippi now takes the cake for being the worst, and a lot of these states in the South and Arizona passed New Jersey. They had an epic screw up when the pandemic started because of their nursing home issues. But all these states down here have actually passed them and done much worse, unfortunately. Nebraska as a whole has done fairly well. However, partly that's because areas of Nebraska have done very well. If you look at the mortality rate by region, you'll see that Lincoln Lancaster County has a low mortality rate. If we were on that state comparison, we'd have the 4th lowest mortality rate in the country. Omaha Douglas County a little better, not as bad as the rest of the state. Well, almost how Douglas County was able to put in some mask requirements last surge. Their schools have actually had mask ordinances for mask requirements, for example, and so they've been able to do almost as well as us. But because their health department was overruled by the state, they weren't able to do as much as Lincoln. And so you can see comparatively, we've had almost half the mortality rate of the rest of the state. Another way to look at it is if we had done as well, compared to the other state areas, how many deaths we would have in Lincoln Lancaster County. by putting in good public health measures, higher vaccination rates, mask requirements, things like that. If we'd have done like the rest of the state outside of Omaha and Lincoln, we'd have 267 more deaths than Lincoln. If we did like Iowa, we'd have 385. We did like South Dakota, we'd have over 500 more deaths. So public health efforts, some people are getting tired. I hate wearing a mask just as much as anybody. However, it does work. And so by having things we have in place, that's kept our mortality rate lower. And it is important for us to do what we can to keep this mortality rate low. Now, how are we going to fix the problem? I think maybe we need a reframing of the issue, mandating responsibility versus mandating vaccines. If people don't want to get a vaccine, there are other alternatives to prevent spread. So maybe if we give people the choice, which is essentially what I think the Green Pass does. So we could have a vaccine mandate, which is what we've done for other infectious diseases in the past, but people forget it took us a couple years, a lot of those other infections to get there. Maybe if we started framing this more as a choice of responsibility, that you as an individual have a responsibility to those around us, and you have a choice of doing one of four things that would help actually prevent you from infecting others. One, you could get vaccinated. Two, if you have had coronavirus in the last 6 months, you're probably immune for that 6 months, but not much long after. We are seeing waning immunity, and I'll show some examples here in just a second. Or you could do a negative test in the last 48 hours, then you know that you basically are not infectious right now, or you could wear a mask. And all of these would work. So maybe if we frame this as a choice, and then people simply have the green check on their smartphone, I can come in versus I can't, that would give people the choice, yet also prevent spread. Maybe this would get us there. I do like, for example, Marcus Theaters putting out this option that they're going to have movies that are vaccine required. So people will at least have the option. If you don't want it, if you don't want the vaccine requirement, you just go to that movie. And to me, this is kind of like the old no smoking sections that we used to have. A lot of us didn't like being around smoke all the time, and really liked going. We basically preferentially go to restaurants or places where there was no smoking until there was an indoor smoking ban. Well, maybe we need to start creating some COVID-safe places voluntarily. I think because the majority of people in Lincoln are vaccinated, if restaurants and bars started catering to us vaccine responsible people, I think I would certainly this winter, I would preferentially go to those places. So maybe we can create not just theaters, but other places for us to go to stay safe. The other thing I think we need to start talking a little bit about is, do you have an ethical duty to protect those around us? In healthcare, this has been sort of a time-honored thing. So even pre-COVID, a lot of hospital systems, for example, would say you either have to A, get a flu shot, or B, wear a mask all the way through flu season. I think we need to start doing that. And so, for example, in public safety, police, fire, EMTs, you're helping to protect the public, but you're not if you're going to give the people you're serving COVID. I think the other thing that needs to come up is teachers. Do teachers have an ethical duty to either A, get vaccinated, or B, do one of those other things? And when we put this in place, at least in Lincoln and in some other schools, well, we've got masking required to help prevent from spreading kids until we can get those kids vaccinated. I think this needs to be the next area of discussion, is what places should be required to get vaccines as terms of employment because of your ethical duty to protect. AMA recently weighed in on the OSHA COVID-19 vaccine mandates. Now, keep in mind, I think people keep forgetting that there is an option of testing in this. The courts are probably going to tie this up, so I doubt this is going to happen anytime soon. So what the American Medical Association and a lot of other healthcare experts are doing is saying, well, companies, why don't you just voluntarily do the right thing? You don't have to be mandated to do the right thing. Why don't you choose to do the right thing? And so I think this will be a big topic of discussion. My role as a school board member, I'm going to be raising this here in the next couple of weeks. So what are we going to require of teachers, for example, when we come back from January? I'm only one of 7 school board members, but you can probably guess what my opinion is. The other people are talking about, well, are we heading to what's called some people are calling an endemic transition, where COVID is just out there and, quote, we have to live with it. What would make it better and tolerable? There's still a lot of these theories about natural immunity, that somehow that would just protect us if we all got everybody infected and then they'd just be immune. Unfortunately, that's turning out not to be the case. And that's never been the case in any other infectious disease previously either, basically. We've controlled everything from rubella to typhoid by either public health measures or vaccination. So I think one way to look at it is Arkansas. So Arkansas, for example, people thought initially that first summer that, oh, maybe this is a seasonal virus, it's been enough spread that we don't know about, that people are immune. But unfortunately, that didn't work out. And in that first summer, they had a surge of cases that led to quite a few deaths. People thought, okay, that was it. We let it spread. And then we had the huge winter surge, and people again said, oh, enough people have gotten it. We were at, quote, natural immunity. Rates went really low. Everybody thought they were doing fine. And then this Delta wave, Arkansas was the first state that was hit, and they had yet another huge wave. And now people are saying again, okay, maybe they're finally hit, quote, natural immunity. So far, we're not seeing evidence of this. And so for me, what I'll be watching, if maybe this is case, maybe if you get infected twice, you're now immune. I don't know. Only time will tell. And so I'll be watching Arkansas's rates. They were the first to enter the Delta wave. How long will it last? Will it actually last, or will they start heading back up again? And so we follow the Arkansas rates. I do have some concern that yes, they had that, the summer, then they had the huge surge, then unfortunately another big Delta surge. Will that stay low for a while, or will it start heading back up again? And actually what you're seeing is it looks like it might actually be starting to head up again in Arkansas. And so watch this over time, and we'll see if Arkansas has in 3 to 6 months from now another big surge. We'll know that this natural herd immunity thing just isn't going to work. We're going to have to vaccinate and potentially have boosters periodically. So in the meantime, what can you do? Well, basically, it's now been released that everybody over 18 should basically get a booster, in my opinion, and they're eligible for everybody. So if it's been 6 months since your last shot, go ahead and get that third booster. I think that would keep our hospitalizations under capacity if we can get enough people to do that. So far in Lincoln, the good news is we've had over 6,000 children ages 5 to 11 got their first shot. That's 21% of Lincoln and Lancaster County, which is above national averages. So at least locally, we're doing a good job getting those kids vaccinated. And then for the holidays, just like flu shots, the best way to protect grandma is to get her grandkids vaccinated. So do your best to make sure that everybody in your house that's coming has been vaccinated. And if not, it doesn't mean you can't get together. There's a second alternative, and that is rapid tests. And so, for example, I was at the state education conference last week, where unfortunately in Omaha there were no requirements, and I'd say out of a couple of hundred people, maybe only 20 of us were wearing masks. So when I got back after a few days, I did do a test just to make sure that I didn't have a breakthrough. I didn't. I've had 3 Modernas, but I want to do this to be safe because my parents are coming and my father-in-law is going to be there. And so if there's people that are questionable in your family, I've already heard stories of people not being honest about their vaccination status. So if you're not confident about somebody's vaccination status, but you still want to have a good family meal and get together with them, I think these rapid tests are a nice, easy, safe way to do things. You can pick them up at the local pharmacy. You can get mine were $23 for a 2-pack. I think this is a way for you to at least provide some level of safety, but still get everybody together if those around you are not vaccinated or at high risk or may have been exposed. So hopefully this is helpful to you. This is what I do for a living, so you know what I actually do. Disclaimer, these are my opinions expressed in these YouTube videos, not necessarily those I work for, but hopefully this is helpful.